F yes, girls. This is amazing. And what a win. What a win.
Pretty emotional there. Tonight only on 3TV, women everywhere are celebrating the decision to pull Bayer's birth control Essure off the market. The medical device industry and the FDA are scrambling right now to do damage control before a powerful documentary hits Netflix tomorrow.
Just hours away now, it exposes how we've become a guinea pig, or a society of guinea pigs, for these devices, which don't even have to be tested before they're implanted inside your body. Nicole Kreitz sat down with one Valley woman who's featured in this film.
A lot of people are wary about big pharmaceuticals not realizing the medical device industry is less regulated and has the potential to do far more harm. We're talking about devices implanted in your body, sometimes for life. And while cutting-edge technology sounds cool, the bleeding edge is a warning. The latest, greatest, newest also means there's often a fine, unproven line between what's life-saving and life-threatening.
It is going to shock people.
Medical devices are everywhere. It costs $25 to bring to market, and they sell for $2,000 a pop.
That whole documentary
What they did was willfully ignore the risks that they were putting these people to.
is going to shock people.
My body hurt. I just kept saying, I don't feel good.
Kimberly Huddleston was one of the first women in the world to get the permanent birth control implant Essure. A young mother of 3 at 24, she joined the original clinical trial 18 years ago.
It was on the radio. And it was pitched as a new birth control trial, free.
She said she had severe pain and nonstop bleeding that lasted for years.
I went in and I said, I need this removed. And they said, you need to leave.
They kicked her out of the trial the next day and wrote in her medical records, patient lost to follow-up.
So they lied.
Almost all women who participated in the clinical studies rated their satisfaction with Essure as good, very good, or excellent.
Kimberly is part of a new Netflix documentary uncovering disturbing truths about the $400 billion medical device industry.
They would say, are you happy with the product? I would say no. And they would say, but you're not pregnant. I would say, correct. Well, then it's doing its job. So you have to be happy with that.
Multiple people's trials and research was actually altered.
Director Kirby Dix says the FDA lets companies supply their own proof their medical device is safe, and even more concerning, they do not require any pre-market clinical trials.
And so what does that make us? That makes patients guinea pigs. And we were really surprised that many doctors did not know this. In fact, many doctors who were implanting the devices themselves assumed that those devices they were implanting were tested in humans first.
Have you ever had any surgeries?
I had a medical device that broke, leaving fragments everywhere, which set off a connective tissue disorder that started deteriorating my joints.
Holy crap.
Yeah.
Angie Firmalino is also in the film.
1 in 10 people will have a medical device implanted in their lifetime. At least one medical device. Everyone will know someone, a family member, a friend, a loved one, that's going to have a medical device. So this affects everyone.
She's gone to Congress and the courts to demand better screening before devices get FDA clearance, and says the feds have also dropped the ball on the promise to track complaints, complications, side effects, even deaths.
It's infuriating, and they're still doing it today. We've watched women, become part of this new clinical trial, and the same thing is happening. If they have a problem and they're bringing it up to the clinical trial doctor, they're being dismissed. They're being told it's not related to the device.
She's also fighting for a law to give patients the right to sue if their medical device makes them sick. Right now, certain fast-tracked devices are protected from patient lawsuits.
Recall Essure! Boycott Bayer!
Angie is one of 16,000 women the courts gave permission to sue Bayer because of Essure. She hosted this screening for The Bleeding Edge outside Bayer's corporate headquarters last week. 3 days later and 1 week before the documentary debut, Bayer announced it will finally stop selling Essure.
We made this decision based on a decline in Essure sales and the conclusion that the Essure business is no longer sustainable.
An amazing thing happened. Essure was taken off the market in the United States. And
we're such a long way from this being over.
Like Kimberly and Angie, Mikola Boudry from Mesa also had a hysterectomy to remove her Essure coils.
People ask if and when we get the device off the U.S. market, if we're done, and the answer is no. there are still unsuspecting women out there that have this device that don't even understand that their health issues are directly connected to this.
They knew. They knew that what they did was wrong.
Bayer says the FDA investigated and found no evidence the clinical trials were botched or biased, and says the documentary presents an inaccurate and misleading picture by cherry-picking information to fit a predetermined conclusion.
I want to emphasize that there has been no change in the positive safety and efficacy profile of Essure. The U.S. Food and Drug Administration has maintained for several years that the benefits of Essure outweigh its risks.
Patients and advocates say, watch and decide for yourself.
This film is kind of a glimpse into the future. And if we don't get this process right now, there's going to be not hundreds of thousands of people being harmed each year, but there are going to be millions of people.
The FDA commissioner says we shouldn't have to choose between safety and innovation. He just put out a whole tweetorial promising big changes ahead of tomorrow's Netflix documentary. Essure, just one of the devices profiled.